Chong. Can you hear me better? I'm a clinical nurse specialist in melanoma team. I'm going to talk about the downside of the treatment for advanced melanoma. Actually, I talk about this almost every day at the clinic, except after hours, holidays, and weekends. But I have taught this more than 5 audience in the small exam room, so I'm a little bit nervous, but hopefully I will give you the talk that you understand and remember something, okay? So we will discuss the possible side effect from the immunotherapy and the targeted therapy that Dr. Tahini talked, including the symptoms, timing of the onset, how to monitor, how to evaluate, how to manage. And also we'll talk about the embryo fetus toxicity, emotional distress, financial toxicity, and what to take home, okay? So the side effect from the immunotherapy, we call this immune-related adverse event. When I come to America, I heard that Americans like the shortening things. So we call the IRAE or IRAS. So you will hear this over the talk, okay? Basically, this is the inflammation of any organs. As Dr. Tiny said, we're boosting your immune system to fight the melanoma. So this happens to all over the body. When it affects the system, obviously it causes the fatigue. Usually the fatigue doesn't last all the time. It may last for a few days to a week, but most of the time, most of people on therapy able to do daily function. It occurs in a certain organ system, like a skin, which is the largest immune system in the body. So rash, itching, and it can inflame in the liver, lungs, small bowels, or endocrine system like a pituitary gland, thyroid gland, or adrenal glands. And it can inflame the eyes. It can cause some burning sensation, weakness, or joint pain or muscle pain. It can lower the blood count and more because we have more organs in the body. Now, you want to know when it may happen. So IRAS occur early from weeks to up to 3 months or over the prolonged period of time. In 6 months after start of treatment, or it can happen as long as a year even after the completion of the treatment. Because once it boosts your immune system, it's in your body we believe, up to 6 months. And then after that, still it can change and then cause some side effect. Each IRAS has a different typical timing of the onset, and each individual has each individuals are unique, so everybody can have side effect in different time. So the graph shows that from 2012 that the onset of the rash, pruritus, which is itching on the skin, can happen after first treatment in 3 weeks, and followed by the diarrhea and the liver toxicity and the inflammation in the pituitary gland after 6 weeks. This slide is from Dr. Tahini and his colleagues' study that I want to show you the common side effect and severe side effect, how often it could happen. So I spoke to the author, Dr. Tahini. It's hard to read all these graphs in this short time, but basically what it shows is that he mentioned the combination of treatment and the single treatment. Apparently, the combination of treatment can cause more side effect. And the dark colors in the bottom is a severe toxicity, which can happen less often. Many studies shows that about 70% of people shows side effect, any kind of side effect at any grade. How do we monitor the side effect? So we are gathering the information. Basically, you tell us what's going on. You know your body more than anybody else. So we'll follow what you tell us. And then we see something during the physical exam. That's why we see you every so often, before each treatment. And we do blood works, shows the liver function, kidney function, thyroid function, etc. So we may catch something from the blood works, even though you don't have any symptoms. Or we find something from the scans, like the CT scans, ultrasound or something, whether you have symptoms or not. And then we identify the toxicity, whether it's from the treatment or if it's from infection or any other symptoms, which can cause the same symptoms. And then once we know that this is inflammation from the treatment, we usually grade them, mild to severe or grade 1 to 4. It helps us to decide what treatment you need to manage the side effect. So this is a fancy term, fancy medical term. We put itis, which is inflammation. Like inflammation of the liver, it's a hepatitis. Lung inflammation, it's a pneumonitis. Small bowel inflammation, it's a colitis, or inflammation in the pituitary gland, which is hepatitis. So once you have any of side effect, we usually go by this itis name. When we say you have this itis, how do we manage it? We do education. We will give you a lot of information. Caroline, the care coordinator back there, is great. We are probably on top of everything to give you information, probably more than you need. When it's a mild side effect, like grade 1 or 2, we start using the supportive care, like over-the-counter steroid cream for itching or rash, anti-diarrhea medication for diarrhea, or pain reducers if you have a joint pain or muscle pain. We may withhold treatment just to be safe. When it's severe, we may use oral or IV steroid. It depends on the grade. So basically, steroid is immune suppressant. Because all these problems are from immune boosters, we suppress the side effect. The steroid, although it's immune suppressant, we are not reversing the effect of immunotherapy. We're just giving you the dose to control the side effect. When we give a steroid, we also think of how long we need to give the steroid, how much dose we're giving you, and we talk about all possible side effects from the steroid. And to prevent the side effect, we may start oxygen reducer or preventative antibiotic breeding treatment. When you have side effects, severe side effect, we may add other immune suppressants to control the side effect better for like colitis or hepatitis, inflammation in the liver or inflammation in the small bowels. Or when it's really severe, we may discontinue the treatment, but we'll discuss it at the time. We have a multidisciplinary team approaches. So basically anything happens, depends on the problems, we will consult to the specialist. And at the Cleveland Clinic, this is a unique meeting that we have a monthly IRS humo board. So all these the disciplinaries got together to review the different difficult cases. So we come up with the best resolution, whether it's safe to continue the treatment, how to manage it. Okay. Oops. So sorry, I was too fast. So after all this, if you have any adverse event, what to remember? I don't want you to remember all of this, it's just too much. And only thing you need to remember is contact us if anything happens. Okay, so basically what I told the patient is, if you see any changes, let us know. So call us or email us, and then let us figure it out. Okay, once it happens, we'll ask you to have more blood works or scans, then we'll figure it out. So let us know. Now we're going to talk about the side effect from the targeted therapy. Basically, these are the oral pills. Dr. Tiny mentioned that there are two combinations. Each combination has a different side effect profiles, but in general, the common side effects are fatigue, fevers, chills, It makes the skin sensitive to the sun, so it can get the sunburn easily. It can cause rash. Since it's oral medication, it can upset your stomach. Rare side effects are elevated liver enzymes. It can cause some bleeding, clotting issues. Somebody may have some hypersensitivities, elevated sugar, blood sugar. It can change some visions. It can change in heart muscle. So we do blood works. We do check your heart as a baseline. So we do preventative measures to monitor this. Again, we go by what you tell us. When you're on the targeted therapy, we see you less often the immunotherapy since it's oral medications. So if anything happens between this visit, we don't know. So you should let us know what's going on. If anything happens, then we'll see you again for physical exam. We may add blood works. We'll do scans, like a chest x-ray if you have a fever to rule out you don't have any pneumonia or any other source for fevers. We will do a heart ultrasound to check your heart if you present any symptoms like that. And also we do consultations like for any vision changes. Of course, we cannot see behind your eyes, so we'll send you to the eye specialist. How to manage it when it happens? We do education. And we start with the supportive care, over-the-counter fever reducers for fevers, anti-nausea medications, anti-itching cream if needed. If it doesn't help, we may pause the treatment. The targeted therapy usually causes side effects, but once we stop, usually it takes care of itself. So we may pause treatment from 3 days to a couple of weeks until the problem resolved. If it happens again, we may use a low dose of steroid for short term. And when we resume the medication, we may reduce the dose. For severe side effect, we do all this treatment, and then if it still affect the quality of life, we may discontinue the treatment. And also, we refer you to see the specialist if anything severe. Okay, again, what to remember? Anybody? Yes, and let us figure it out. Okay. How does medication affect the pregnancy and breastfeeding? Both treatments can cause harm to the babies, feeders. So we recommend at least 2 effective birth control methods. And it's unknown whether treatments are in the human milk during the breastfeeding, but there are animal studies that they found that the medications are in the animal milk. So we're not using this during this period of time. When you have a side effect, it's really devastating. Not only you have this unfavorable side effect, but you are not getting treatment for your cancer. So this emotional distress, Dr. Marcus will talk about it more. I just want to share with you for the resources what we have. We have social workers, oncologist, psychologist, and psychiatrist. We have a reflection on the first floor. They provide the free massage, relaxation techniques, Reiki, to reduce the emotional distress. We have art therapy. The patient services have different services for your care. And the local resources, the caring place in the Beachwood and the Westlake, Stewart Caring Place in Akron, American Cancer Society local branches has great programs to support you.
Thank you. That was my talk.
Oh, we don't talk to each other. Sorry. And also, this treatment that we're giving you is unfortunately not cost-conscious treatment. It's very expensive. So another side effect would be financial toxicities. We have great financial counselors to see them if you are in financial difficulties. A lot of drug companies, actually all drug companies that we're using for the melanoma has great programs to reduce the copay or give us free drugs. And those websites are from the financial counselors. Sometimes they have more resources for the assistance. Sometimes they have really limited. So it's actually what comes, what serves first. So I can tell you what we have now, but if you have any difficulties in finance, please contact them. So again, what's the take-home messages? During the office hours, after hours, we're not here, so 8 to 5. Caroline and I are pretty good to return your calls on the same day or very next day, depends on what it is, but we're always glad to hear from you. All right. Thank you very much.